Welcome, everybody. I'm Dr. Steve Rasner, and welcome to the Lionhearted Dental Podcast. Tonight's guest rings very warm in my heart um, because he's the poster child for a gentleman. You know, who doesn't like old school class? And it's interesting how I met him. Many of you know I gave a 2-day business course last year in Philadelphia. And, he didn't when he registered, he didn't say anything like, oh, you know who I am, right? Or anything like that. And so I had no idea he had this giant following already on Facebook. And he was just, everybody in the course knew who he was. I didn't, I'm not on Facebook all that much at that time. So he is a special guy, and I thought it would be interesting for you to hear his story and his philosophy as well. So welcome to the show, Dr. Javier Quiros, my man.
So I'm just a wet finger dentist that I see 10 patients a day or sometimes only two. It depends on how big the case is. But I still work 5 days a week. I love dentistry. Um, but you know what times makes you is that makes you grow. And then you also have to become a businessman. And that's what I hope we can talk about today with Dr. Rasner, who's also a great dentist, but also has to take care of the business of his office, isn't it, Dr. Rasner?
Yeah. Well, I thought what was fascinating about you, and I mean this. I mean, I realize, of course, you can have success if you are practicing in Alaska or remote parts of Canada and Europe and whatnot. But when I got started to unfold your story behind you, what is amazing to me is Javier has 5 practices. Am I correct?
Yes, sir.
He has 5 practices, but he practices in Costa Rica. Now, forgive me if I come off as I don't know what I don't mean to be disparaging to the country of Costa Rica. I just in my brain would think it's universally not a very affluent country. I could be wrong. It doesn't even matter to me. I just am shocked that you have found that level of success. By the way, until I started seeing his work, which is why he is so successful, along with many other things. But tell me about that. Is Costa Rica generally a very an affluent country?
No, we're not an affluent country. We are in the middle of the tier. We can compare only with middle class America, maybe very, very middle class America. That's the way that we can compare. The good thing about Costa Rica is that we are very stable politically wise, and we have also a big middle class that can afford the kind of dentistry that I want to do. I've been fee for service for since I started 25 years ago, and I'm proud of that because I have been able to build a business and a good practice without depending on insurance companies. Costa Rica, we have a lot of uh, dental tourism, people that come to Costa Rica for a week or two and fix their teeth. I don't have any of those patients. Most of my patients, maybe 99% of my patients, are either Costa Ricans or foreigners that live in Costa Rica. We have a big expat community here in Costa Rica. I think we have about 300,000 Americans already living here. We have about a million foreigners living in Costa Rica, and we're only a country of 5 million. So If you guys think you have a problem with immigration, imagine us. We have maybe 20 or 30% of our country are not from Costa Rica. So, but we love Americans. When we see an American in Costa Rica, we are thankful because most of them come with good stuff. Most of them come
Yeah.
to build businesses, to work, or to invest. And we love that. And you know what I love about them? They all have teeth. So,
Wait, so I need to take you back,
yes.
and especially this next point is for anybody that's followed me for many years would know that I've echoed this next thought, and that is that, and I believe this in my heart to be true, and I know it's true, and that is that it it doesn't matter where you actually ended up practicing. You could be in a very rural area of Alabama, or I can't think right now, Tennessee, Wyoming, Idaho, areas not heavily populated. Um, and I pardon the cliche, but I know it to be true. If you build it, they will come.
Yes.
That's from the movie Field of Dreams. Ask me how I know that. Well, if I look out my window right now, I'm looking at a part of Cumberland County, New Jersey. You can Google it yourself. Don't take my word for it. And it's one of the most economically challenged areas in the United States, not in just New Jersey, in the United States of America. And if you look around the room, I'm in a building that is my dental office, that is a fee for service practice surrounded by insurance driven practices. So I tell you that not to be braggadocious and brag. I'm telling you about the possibilities. Here, I had it, in my opinion, much easier than Javier because I'm not on an island. I do have unlimited populations that can come to me without getting on an airplane or a boat. And so remember this wherever you're at, it's in front of you, meaning the only thing stopping you is the mirror right now. That person in the mirror and the stories in your head as to why you think you can't be the next Dr. Quiros. It's really up here. You must believe that. And I wouldn't say it to you if it wasn't true. I want to take you back for a minute.
Yes, sir.
I want to take you back. I know you had a very, very amazing education. I don't know where you went to undergraduate school. Let's start there for just a second. Where'd you go?
I did go to the University of Costa Rica. It's one of the top 10 universities here in Latin America. And that's where I did my college and dental school. And then,
And dental school.
yeah, and dental school.
And then what?
And then I moved to the States. I got very lucky because I had the University of Costa Rica had a deal with Baylor College of Dentistry in Dallas, Texas. So I got a scholarship to go over there at Baylor, and I met some amazing people. I met Dr. Bodymapper. I met some of the stars of the beginning of the aesthetic revolution, and that's where I learned how to do a lot of cosmetic dentistry. I also did an AEGD residency of 2 years, and then I stayed for grad pros with Dr. Ronald Woody, who is also a pathologist. So I had a very comprehensive education that really focused on aesthetics, occlusion, prosthodontics, and a lot of restorative dentistry. I still love doing restorative dentistry. I still do fillings, crowns, implants, full mouth rehabs, and veneers. That's my
So,
everyday.
so you finished that great education at Baylor,
Yes.
and I'm jealous because my post grad was right down in this county, down the street, 15 miles, with my father, and God bless him.
Yes.
He was kind of a mom and pop dentist.
Yes.
I am grateful for that opportunity, Dad. if you're up there listening. I really am. Uh, I would tell my colleagues and or my D4 friends in dental school, if you can get a post grad program, that's where you should go. You post grad program first, but then you finish this and you go back to Costa Rica, where you fee for service right out of the gate.
Right.
Were you an associate? What happened right out of the gate?
Yes.
You opened up your practice cold.
Yes, I opened up my practice code, but I when I finished at Baylor, uh, I got an offer to stay, and I got an offer to stay teaching at the restorative department, and I thought about it long, and I said, you know what, I love my country, I love my people, I really like the also the growth that the country is having, all the Americans that are going down there and living in Costa Rica. And I'm just gonna go back home and start from scratch. And that's what I did. So I started with two dental chairs that my dad bought. I'm very grateful to my dad too. He bought me two dental chairs and one assistant. I started like that 25 years ago. And yes, I have grown. And
But you said you fee for service
yes,
right out of the gate.
right out of the gate. Yes. And
Did well, I mean, explain that. You just like you thought about, am I going to stay there at Baylor and go on faculty, or I'm going to go on my own, which you did. Did you consider? Do they have dental insurance in Costa Rica for
yes.
starters?
Oh, yes. Yes. There's dental insurance. So when my patients walk into my office, then they ask if they can file insurance. I say immediately yes. And I learned that from you. But what I tell them is that I will fill their form and that they have to file it. Which I know that is not very helpful for them, but is what I say. And my secretary, when she answers the phone and somebody asks if we take insurances, we say yes. But then I have to educate them, that we will more than happy get with the insurance company, fill their form, and send them X-rays and photographs. But then they will have to file them on their own, and that way I haven't had any problem. On the other hand, from day one, I decided to be a comprehensive dentist. So my secretary also tells them that I'm going to take x-rays, photographs, models, and that I will make a treatment plan for them. That I'm not, a fireman that is just going to fill the tooth that is broken. That I'm going to look at their whole mouth, and that if they agree with the plan that I have, I can also have some options for them or do it in stages. And that's the way that I work, Dr. Rasner. You know, I don't see millionaires or models or actors. I see everyday people like you. People that are either professionals or workers or blue collar that can afford a couple crowns or can afford a full mouth. You know, and that's the way that I approach them. I show them photographs and X-rays of their teeth. I never talk to them about money. I only talk to them about what they need. And once they are happy with the way that I treat them, once we are friends, once we have talked about soccer or American football, once we have talked about what they like about life, then we talk about money. Once we are friends, we talk
Hmm.
about money.
Now, do you normally? This is great for me, and it's great for my listeners. When you do a treatment plan,
Yes, sir.
do you do you often have the ability to present what you think they're going to need day one? Is that half the time, a quarter of the time, or do you have to do your wax ups and have them back and all that stuff?
99% of the time is on day two. I'm sorry to say
Okay.
that because I have
Yeah.
found that in day one, I don't have the rapport that I need to be able to offer them a big reconstruction or even a set of veneers.
Yeah.
This thing about dentistry is very emotional. That Dr. Woody, my uh, pros director, said, nobody has died if they don't have teeth. They can live with no teeth. You know, You cannot live without a liver or without your heart, but you can live without teeth.
Yeah.
The only thing that's going to change is that you're going to get fat because you're going to eat Cheetos all day long. That's what he used to say. So it's very emotional. It's not needed. It's some.
Interesting point. I used to say all the time exactly what Dr. Woody said. I would tell my audiences that what we do is elective because people can live without teeth. If you practice more than a few months, somebody's going to come in to you. They're going to want a solution, maybe, that have been without teeth, or maybe they tried dentures for a while, but they gave up. They just don't go that way. And the reason I'm echoing what Javier's saying is because it does change the rules of engagement. And what I mean by that, I'll elaborate on whether a patient says yes or not. You have to be palpably different. All right, I just had a patient before we came on the podcast.
Yes.
An educated man. He superintendent of schools just now. And I looked at his mouth. It's an interesting story. And he had been restored behind his cuspids. I say that for a reason. Pretty nicely many years ago. Gold restorations. His vertical dimension of occlusion was intact. It was very odd because 6 through 11 were blown up as if like a bomb went off.
Wow.
They're restorable, but they need endo. They need absolutely full coverage.
Yes.
They're full of restorations right now. And it's funny what we're saying about all this. It all ties in because what was going against me with him was this, is that he had that all done under insurance. Okay.
Okay.
He had an unusual maximum of like $3,000 years and years ago. And I knew as I was speaking to him that wasn't going to be the case. I'm differentiating him from many other patients that come into me throughout the years that, oh, my insurance covers everything. We all get those patients.
Yes.
It covers everything. It covers the fuel in my car that I use to get here. Okay? We all get those patients.
Yeah, I know. It has to.
But that wasn't him. He was very cognitive, very cerebral, and he really believed this insurance is going to cover everything. And I knew it wasn't for no other reason that I'm out of network, for one thing. So we have to make that abundantly clear. But the reason I'm saying all this is because I knew from the beginning that I better establish this guy's got to like me. This guy has to trust me.
There you go.
If this is going anywhere. And he didn't commit today. I did treatment plan him, but he wasn't pushed a hair. In fact, I'm sure one of the things I said was, one of the things you can do today is nothing. Just go home and think about what I've said to you, because I'm sure this is very different from you from a financial point of view than you're used to. So I find it very interesting. You're not talking about one patient. You're talking about how you established 5 different practices in Costa Rica. And particularly that 99% of your patients come back for a second consultation because you said you want them to like you first. You want a relationship, right? Is that what you said?
That's what I say. You know why? Because once I become friends with them, I don't even have to sell them anything. I know we have to sell our work, but if you're friends with them, then money is not a big issue. Money is something secondary. So what I try to tell them is that I'm willing to fix their mouth the best way that I can. But like I was saying, it's so emotional that I have become like a master on mock-ups, because I do mock-ups every day. They want to look at themselves once they're done. And so I have a lab tech in my office that waxes up or exocats all day long. And then we do a lot of mock-ups. And I have found that that's a very strong way to present your case. If you can show them how they look before you prep, oh, that's so powerful, and it's
Now, do you
real before and after.
what are you putting over their teeth? So, is it acrylic
It's
or a mock-up? Yeah.
Bisacryl, which is something in the line of Loxatam or
Mhm.
vocal structure, something like that. You know, and we do it with the matrix out of the wax up, and I also digitally this smile design their smile and show them
Mhm.
why we need to move the midline or why we have to lengthen their teeth. And they loved it when we do it that way. Every time that I try to push a sale the first appointment, maybe I'm getting what, like a 20% success rate, very low.
Mhm.
But once I go to the second appointment and they know my philosophy and they know my track record, and I show them a before and after of their own face and of
Sure.
a real design, not a computer generated design, then I have maybe 80 to 90% success rate on my case presentations.
Are you snapping that on over their existing teeth?
Yes, sir.
Is
That's
that
what
what
I
you're doing?
do. That's what I do with the bisacryl. And it looks beautiful. I mean,
It
it's just a great way to communicate.
so I know somebody watching is thinking this. Do you do you charge for that, or you just do
Well,
that?
I used to charge for that. And I used to say, you know what, I'm going to charge you $500 for the mock up. And so, right out of the gate, maybe half of them will say no, you know. But if I have 80, 90% success rate every time that I do it,
Sure.
then it's built in the fee, of my veneers or my full mouth. And so nowadays I only charge for the consultation, and I do a mock-up. So I charge what, like $200 for the consultation fee and treatment planning, and that includes the mock-up, and that includes the treatment planning. um,
So what do you do? Boy, this is really good. I mean, I'm interested in all this.
yes.
What do you do with that patient that comes in? Like I had on Monday, I know what I would do. I know what I did.
Yes.
That has a lot of broken teeth. They're asymptomatic.
Yes.
Most of the broken teeth are just broken because prior restorations have broken out. It's not like you're looking at a bunch of active caries, but you are looking at somebody that's got parafunction, that's busted up a lot of teeth, and they want to replace 6 through 11. And they say to you, that's all I can afford. So what do you do with that? I'm curious.
Well, if they have posterior support, even though if their teeth are not in very good shape, but if they have posterior support, I will do 6 through 11, and that's all.
Hmm.
You know, but I'm what the patients that are more difficult are the ones that have just enough wear that they that they have pathological wear, but they don't have any issues with function, or with big issues with pain or broken teeth. Those are the hardest ones to convince, because it's all more preventive and emotional and aesthetic, and so with those patients, that's what I think, that the mock-up is a great communication tool. You have to listen to them, to those young dentists in the audience. Please do not talk to them about how many newtons per centimeter you're going to torque that implant. Please don't do that. Please don't talk to them about the bonding resin that you're going to use. Please communicate and listen to them and repeat what they say. Doctor, I have pain on this tooth at night. And then you look at them in the eye and tell them, so you're telling me that this wakes you up at night? And so when you repeat what they are saying to you, they actually feel like they've been listened to. And it's sad, but it's true, Dr. Rasner. Most people are not listened nowadays. Most people are just a number or a clock, and in the machine, and when you look at them in the eye and you repeat what they say and you sincerely take that in your heart, and you feel like you can help them. Oh, that's the sweet point of your day, where you can communicate, and you have to be a good communicator if you want to do full mouth rehabs, or if you want to do big cases. So that's the way that I approach it.
You know, I want you guys to know something I'm thinking as Javier is talking right now, and that is that there's a difference between a patient not committing to you when you present the treatment if it's based on money, on day one money, versus them not committing to you because they may not have the funds right now to do what you recommend they do. Let me explain what I just said. So I had two patients today. The first one came in, and it was a challenge because I was told that he had done his research on the internet, and he wanted an all-on, and he was absolutely a great candidate for an all-on, a maxillary all-on. And he also told us in the interview, told Michelle that he was limited on money. So when I went to present, he had multiple teeth left, but he really was an all-on candidate. When I started to think in my head of alternatives for him, a partial denture, a limited fixed crown and bridge, things like this that would cost him less. It goes through your mind as a clinician. But I didn't. I listened carefully to what he wanted because I brought up. I said, you know, and I don't dodge the finances connected to an all-on. You can't. It's a substantial investment, and I want them to know that's where it's going if they go that direction. So when I would bring up to him other alternatives in the words that I used, he was very clear that he didn't hesitate or pause at all. He says, I don't want anything removable. Now, this is a man talking to me
Yeah.
that did not have interior incisors in his smile. He had nothing. It wasn't like he was putting up with a partial.
And now he wants
He had,
something fixed.
yeah. And so when he left today, and I was told by Michelle that he's going to go home and try to think of or try to explore ways to address the financial responsibility of this, I don't consider that a loss whatsoever. Even if he doesn't do it ever with me, if he goes somewhere else for 20% less, it doesn't matter. That is a good thing, in my opinion.
Yes.
Or when a patient, the second patient I was talking to you about that had all the restorative work years ago and now was faced for the first time ever with a significant out-of-pocket expense to restore his front teeth. It was $14,000. It wasn't a little bit.
Yes.
And he wants to think about it. He did schedule for a root canal because it's the only active pathology that I saw that he had to treat, and I told him that. I am totally fine with that. I'm saying this to you because it's not a failure when you present the work, you connect with the patients emotionally, you connect with the patients in a true, authentic relationship way. You're establishing. Who doesn't want to do that anyway? Don't you want to treat people that genuinely like you and you like them? So, of course, that's the way to go. And if they don't commit, that's not a failure. They may really need to find a way, just like you would, to bring this into their life financially.
Exactly.
Yeah.
You know, and I really like that approach, because then you feel good about yourself at the end of the day, you know, that you did something good for somebody, you know. Even they sometimes they just need an advice, you know, and then you just talk to them sincerely about what they need. And I don't know if this has happened to you, Dr. Rasner, that they ask you, what would you do if it was your mouth? Have they asked you that?
Oh yeah, sure. I love that.
That's the
I love
worst
that.
because it's true. We dentists don't like dentistry. But when they
It's
ask us
true.
about that, that's the way that I follow. That's my philosophy. Would I do it in my mouth?
Yeah, absolutely. So listen, before I lose you with time,
Yes.
I need to ask you a question. First, I'm going to tell my followers, what is your Facebook name?
Oh, it's like my name, Javier Quiros. That's my Facebook, and
Okay,
it's
so
got my face on the cover, so you will not miss it. Yes, yes.
so you'll see his Facebook tag because Tony's going to post it.
Thank.
So when you go on it, be sitting down, please, because you're going to look at interior before and afters that you're going to believe are crowns and beautiful porcelain when you first see them. Here is the takeaway here. Many of them are not. Many of them are composites. Composites. I know you've seen other dentists. I would find it hard to believe that there's anybody I've ever seen that does better, beautiful direct composite restorations than you, my friend.
Thank you.
My question is, do they really hold up?
With
Are you repairing these every other week?
well, I've been doing this for 20 years, and what I have found is that if my patients have good hygiene, and if I fix their occlusion, occlusion is very important. If I give them anterior guidance, canine rise, if I approach this like I would approach a full mouth of crowns, occlusion wise, and also preventive wise, I would say they last more than 10 years. And when they come back, I don't even need to do them again. I just refresh them with a little bit more of microfill composite in the front. But I want my your people and your audience to think that I'm not just slapping composite in there. You know, I'm taking them to centric relation. I'm opening up their video. I'm giving them functional occlusion, just like Dr. Dawson taught us how to do it. I'm also using the best materials out there for composite. We do not use the same composite for veneers than we use for back teeth. It's not the same chemistry. We have to use
Do you mind sharing what you do use? What is your favorite composite for veneers versus posterior?
well, for veneers, microfill composite is the best because it's the smallest particle. So you can polish them beautifully and they have the same texture as enamel. They look just like enamel. Light travels through composite resin, microfill composite resin, just like enamel. So it looks very real. Well, I don't advertise myself. I don't have a marketing budget. I don't pay Facebook or Google or anybody for marketing. My patients come in because they say, you know what, you fix my friend's teeth and they look like teeth. They don't look like porcelain. They don't look like restored teeth. And that's what I want. And then the other thing that they love about it is that I'm able to do it without grinding on their teeth. It's very conservative. So don't get me wrong. If I get a patient like you have today with bum anterior teeth, with pain, with cracks and everything, I do crowns. I still do a lot of crowns. Maybe I do about 100 crowns a month, but I do about 100 composite veneers a month with my associates. And the reason that I divide that in two is because I get a lot of young patients that they don't want crowns. They don't want their teeth to be prepped. And so when I do a mock-up on top of their semi worn down teeth, and they see the result and they know that I can do it without grinding on their teeth and making pegs, then they go for it. Otherwise, if I tell them that I have to grind on the teeth, most of them don't want to now because nowadays with the internet they can Google it, and they all show me pictures of prep teeth. Doc, I don't want this. So if they're 35 or 40 and I can do it without prepping, then I would do it without prepping. But if their teeth are bummed out, I will do crowns. So that's
Do you ever when you're doing your mock-up try-on,
yes.
or even when you're veneering teeth that aren't that worn facially? I'm asking you this for personal reasons, with my own experience. Do you ever get a complaint? Does it ever come out prognathic because you added on to that? Is that ever a problem?
No, because most of our patients already that are maybe 40 years or 35 years older, and they have some pathological wear, most of them already lost 20-30% of their own tooth. So
Okay.
if you add half a millimeter of a veneer, I mean, they just look great. It's just exactly what their teeth need. So I found hard to do is to, if I have a patient that lost half a millimeter or 1 millimeter of tooth structure, and then I have to take away another millimeter in order to do a crown, then I find it hard to do it. And my patients find it hard to do it as well. And so that's why I always give them both options. I also do a lot of porcelain veneers with feldspathic porcelain, which is also great. It's just a little bit more expensive. So when they look at the advantages of composite, porcelain veneers, or zirconia crowns, uh, it depends on the patient. If they have just maybe a millimeter of wear, they all go with veneers, with no prep veneers. But if they have more than that, then I will definitely recommend them full coverage zirconia crowns or Emax.
Two more quick questions.
Sure.
One is, I know how fundamental, like myself, you hold dear to the outcomes of your clinical work, the stability of the patient's occlusion. I know this from speaking with you last year when we met,
Yes.
and from talking to you and following you. Um, what if it's a patient that's missing, they have maybe back molars, they're missing one molar, maybe two premolars on one side? At what point do you insist to yourself and then convey this to the patient that you have to do something for the missing teeth? Like, even not everybody can have implants, of course, and a lot of patients need augmentation before implants, and all of a sudden you're into $20,000 more. So sometimes it's got to be like a partial denture. Do you do that?
Oh, yes, definitely. We talk about that on your course. By the way, I took the Dr. Rasner's business course back in October. It was amazing. If you guys want to really take your practice to another level, you should go to Philadelphia. I think you're doing it again this year, aren't you?
Yeah, I plan on doing it again, and I haven't told you, but I'm breaking news. I'm going to invite you to be one of the speakers there if I do it again. Yeah,
Well, it was.
you're gonna
I had a
you're not
great
gonna just be an attendee this year.
I had a great time, and I strongly recommend it. I implemented everything, Dr. Rasner. The first day I got with all my team, and we spent a full morning going through my notebook. I'm sorry, I'm off the subject, but
It's okay. It's
but
okay.
I loved it, and I strongly recommend
Thank
it.
you.
If your patient does not have posterior support, you should do something. You should,
Mhm.
an RPD is a great treatment if they're willing to do removable, but otherwise, an implant, a fixed bridge, whatever. Because if you only work on anterior teeth and you don't give them posterior support, the anterior teeth is going to wear. So we also talk about full mouth. Remember, Dr. Rasner?
Yeah.
And when you can practice all your life just doing single tooth dentistry, and that's great. But if you feel like you need to get to the next level and you need to become a better dentist, you should go with full mouth rehabs, or at least quadrant dentistry. Quadrant dentistry is great. your profitability is going to go through the roof, and your job satisfaction is going to be great. My associates, I teach them all this. You know what young dentists want now, what associates want now? They want continuing education. They want to grow. They don't care if they make less money in your office than in another office if you teach them something every day. We take airplanes with my associates and we go wherever we need to learn something new. And that's how I met you, Dr. Rasner, isn't
Yeah.
it?
Yeah. I want to tell you two things before we close, because this guy is a real live dentist that has a patient probably in 12 minutes. He hasn't said that, but that's my
No,
guess.
even in about half
Yeah.
an hour.
Yeah. And he's been kind enough to give me his lunchtime today. And I'm so, so honored and appreciative of that,
Thank you.
doctor. Um, Two things I want to tell you that I want you to remember, and it just resonates with you. When he was at my course in October in Philadelphia, and I couldn't help but watch him the whole time. He was vociferously taking notes the whole time, and as if he never took a course before. Like this was his first time out of his office, and of course, that wasn't the case. That is the common denominator I have witnessed in every great dentist that I've ever met. And I mean the biggest of names, be it Michael Picos came to a course up here in my office. I wasn't the one giving the course. It was a oral surgeon from Germany. And Carl Misch I saw. All the great ones are open to never stop learning.
Ah,
And
so important.
you need to do this, right?
So
It
important.
is,
Yes. I still take 3 to 4 big CE courses every year. On implants, on veneers, on full mouth. Because I love growing. Who doesn't? I mean, that's why you and I are still in practice because we like
yeah,
the grow aspect of dentistry, don't you? I mean, we
absolutely.
loved it. It's just
Yeah, and that my second takeaway from listening to Doctor today would be the fact that if you could change one thing that you practice and you can embrace one new concept that would take you the furthest in your career, the concept would be a comprehensive approach to every patient that comes into your office. It doesn't mean they're going to accept a full mouth rehab or even need a full mouth rehab. But when you stop thinking about one tooth dentistry, because that's what they called you for. Nobody calls up our offices and say, "Hey, I need a full mouth rehab. Will you do it?"
no,
You know, actually, that did happen to me,
really.
but that's maybe the first time ever. Now they call up because they broke number upper right premolar. They had pain on the lower left. We all know the story, and it's your job, just like LD Pankey said, to educate the patient to the value of comprehensive care approach. If you did that, now you could go on my early podcast and see what my version is of a comprehensive care approach. I'm not going to do it on this particular podcast. You could do that, or you could create your own, to be honest with you, a derivative of mine or other people. But if you did that, and I say this with full respect to other dentists that are very good at what I'm about to say, you wouldn't have to take courses on Botox or filling up their lips with filler
No,
because you will be so busy
there's so much
with
dentistry.
restorative dentistry, you're just not looking for it. You're not allowing yourself the freedom to think that way because of fear of rejection of your patient due to cost and more extensive work. And the irony of it is the best way for a patient to be treated for long-term oral health. What I like you to close with
Yes.
is, and I ask a lot of my guests this, but I'm particularly interested in you because you're just so true. You're so authentic.
Thank you.
It's hard not to see. What would you tell a 23-year-old Javier graduating from dental school today What would you tell guide his early road to success? What would you tell him to do?
Well, we all have our fears, and I was full of fears when I just graduated from dental school. So, what I would strongly recommend a new graduate, and what I would tell myself is please stop worrying and start enjoying life. Start enjoying dentistry. We have the best job in the world because it's so great to be an artist and a scientist at the same time. So what I would tell my younger Javier is grow even more. You know, I've been practicing 25 years and I have built 6 offices. I have sold 2 of them, but I would grow for 12 if I had 25 years again, you know, because because fear is something that keeps you from waking up every day and growing. So please, if you're a young dentist, please stop with the fear and just love life, love dentistry, wake up early, believe in God, and exercise every day, sleep 6 to 8 hours, and then just come to the office and rock your day and finish at the end of the day tired. And if you're tired, that means that you helped a lot of people and that you were profitable. So that's my
Well,
my advice for any young dentist out there.